Ladies and gentlemen, our next guest has developed his own muscle massage system. He can be seen daily in his own infomercial. And here you see it, ladies and gentlemen. It is the Dr.Ho muscle therapy machine. And I don't know if you see this in the corner, but that is the stamp of approval, folks, as seen on TV. You can trust anything you see on television, ladies and gentlemen. That's the point I'm trying to make right now. Please welcome Dr.Ho. Dr.Ho!
Yo!
How are you, Dr.Ho?
I feel great.
Oh, I bet you feel great. What would you attribute that to the gear you're wearing? Would you?
Oh, absolutely, not to your show. No,
Yeah.
just kidding.
Are you shaking right now?
Oh yeah, no, I'm getting a most
I
incredible
guess my
massage
first
right
question
now.
is, what's the difference between this stuff and the electric chair they use in Georgia?
Well,
You seem to be.
my hair doesn't go up in smoke if this one.
Okay.
No, this feels good.
Do you want to? Yeah. Well, it may feel good, Dr. O, but it's very hard for me to look at you and conduct an
Right?
interview
I know, I'm not easy
while
to look
you're
at.
in the throes of death.
I'm not easy to look at.
No, that's fine.
Oh, no.
Now,
Mike, you know what? You got to try this.
well,
what
before
talk
we
about.
try it,
Okay.
I need to
I'm
see a
glad
little
you said you
something
do.
called a medical degree
Oh, right in my back pocket.
before I let you hook any of this up. Are you, in point of fact, a real doctor?
I'm a chiropractor and acupuncturist, but I've been
Ah.
practiced for 15 years, treating patients with chronic pain and migraine headaches.
All right, good.
Yeah.
And that's been
Actually,
working
just down
out.
the street at Young and Bloor.
Young and Bloor,
That's my
yes.
clinic.
Well, what do you know? Seamus lives just 4 blocks away.
There you go. We even do house
Now,
calls.
They blew the transportation budget this month.
now you had a practice, obviously. You
Yes.
had a practice. And for some reason, you've left what I assume
Well-
was a lucrative practice and decided to go
Well,
into this.
basically, you know, I developed this machine to help my patients. And what I find is, you know, when they get off the table, they'll go, wow, what is that? You know, my headache's gone, or my back pain's feeling much better, right? Can I rent this? Can I buy this? I go, no, that's my prototype. Don't take it, right?
Yeah,
And
yeah.
then, you know, after a year, we have hundreds of people on the waiting list with
Right.
$50 deposit and calling every week, say, can we get the machine? And then it forced me to go out and actually manufacture it at a
Right.
reasonable price so that people can afford.
Now, do you find if people have this machine, they stop coming to the office?
Yeah, I don't see anybody anymore. No.
Yeah. Yeah.
I was wondering what happened to my business. No, no. What we find is, you know, patient satisfaction had gone up dramatically using this. See, now when patients come to us, you know,
So
they,
what
they
you're
feel
saying is they
relaxed.
preferred this to you.
Actually, what they find is, well, that may be true, but what we find is actually complement the professional treatment. So when they come to us, they're not in any pain. So we work
Right.
on education, we can work on correction. So overall, it makes a much better progress, you know, and faster
Great.
progress.
Now, how did you get the idea for this thing?
Well, basically, you know, we have used all kinds of electrotherapy devices in our, you know, practice for 15 years, and most of them really big and expensive. And what I find is they give the same stimulation all the time. And after a short period of time, basically, you know, the body gets used to it and stop to respond. So what I realized, if we change to a different modality, the person starts to respond again. So what I've done is I've done some research around the world. We
Right.
took 12 of the most effective therapeutic machine, programmed to a digital chip, and program it so that you get different type of treatment every few seconds. And that really is a secret because it's always changing. It kind of fools the nervous system, so now your body don't get used to it. That's why instantly you get that relaxation.
So do you consider yourself to be a scientist?
No, actually I have a group engineer that we work together. I just
Right.
give them the idea,
Right.
and they go to work, and I test on my patient until we find a product that really works.
Now, whose idea was it to marry up this kind of technology and therapy to bikini-clad women from 1 to 3 a.m.? That, to me, is sheer brilliance.
Thank you very much, by the way. Thank you.
That's,
Yeah, well, you know, we actually have guys calling, can I get the number for that model? I go,
Right.
no.
okay. And I see you're wearing a name tag, Dr. Ho, trademark registered.
Hey,
Your folks must be so proud.
actually, my mom made this for me.
All right. Okay. Now, when you can't sleep at night,
Yeah.
do you stay up and watch yourself on television?
No, actually, I can't stand watching myself.
Yeah.
No, I don't.
You suddenly have a lot in common.
When I watch, I don't want to be seen, you know.
Now, okay, so you're in charge of a pain. You were in charge of a pain and headache clinic. Now, You obviously know what you're doing. Do you want to try this little thing on me?
Yeah, I'd love to.
All
I
right.
need your shirt off. At least loosen up your tie. Okay? Can you loosen up your tie?
I think we'll start with the loosening of the tie.
Okay, yeah.
If I'm feeling really, really good about you, we'll go a little further.
Or should we ask the audience? How many want Mike's shirt off?
All right. Interesting, huh?
Well, one thing you like is actually very easy to use.
Interesting name, Dr.Ho. You can either strike me as a doctor or a hoe.
Hey, I don't want to be known as a hoe, okay?
All right. So
Well, come over here, Mike.
Yeah. All right. You carry a great deal of insurance malpractice.
Well, we'll see.
All right.
Okay, we just stick the pads on. Like, there's
Right.
self-adhesive pads, okay?
Uh-huh.
You don't need to use any ointments or anything.
Oh, that's good to know, huh?
Yeah.
'Cause I don't
No
have
worry
any.
about allergies.
Right. No, I don't have an allergy to
Okay.
this kind of
Now,
thing.
it's simple to use. It's all automated. We just click it on, okay? And then we turn up a little bit of time. We always advise people to go very slow because when they see this, they go, wow, it doesn't do anything.
Right.
But it's one of the most powerful devices on the market today. Okay, let's get a close-up shot of Mike's face. I like seeing people's first reaction. Here comes Mike. You start to feel yet?
Yeah. Yeah, it's...
Now, you can
I've never had a stroke, but this is...
what it does, okay, they send
What are we wasting time for? Wire up this audience.
basically, send gentle electrical impulses.
Well, yeah, they're gentle, and
you
they're
can
certainly
control them.
electrical. There's got to be some electricity involved.
You see how it's
This
changing?
runs
all-
off of a battery?
Yeah, just two little AAA batteries. Okay. Okay, Mike, watch this. Okay, wait. We'll press here. Now, this gives you a whole different mode. This is what I'm chopping. Now, this one's like somebody chopping
Whoa,
the muscle,
yeah.
kneading the muscle, rubbing it. Okay.
Yeah.
Okay, now,
I feel like I should just give you my name, rank, and serial number.
Okay, try this one.
Oh.
This one's very gentle. Now,
That's not gentle, Dr. Ho. All right?
Hey,
You're
you
not
adjust it.
on
You
the
adjust-
receiving end of this. I don't think that's very gentle.
you turn it down.
I don't think foreplay is your forte, Dr. Ho. That is not gentle.
Hey, get right to it, eh? Get right to it.
All right, there we go. Now, off. I call that gentle. That off. Oh, that off feels good. Off feels wonderful, Dr. Ho. Now, what does this thing cost?
For you?
Yeah. Let's say you're sitting around the house and you don't feel like chewing through an extension cord. What is this baby going to set you back?
Actually, it's only $135.
$135
Three easy pay.
to torture yourself.
I'm going to chew on the extension cord.
Yeah. I'll tell you, next time I feel like doing this, I'm just going to go outside and grab a rock and whack myself between the shoulder blades. That's, well, yeah, here we go. What happens have you ever had anyone crank it up to high and live?
Not.
Jeez!
It is powerful.
I've got it on maximum.
No, you don't.
That was on maximum, Dr. Ho. and
No,
that was
full
not
size
good.
5, right?
That was not good. Huh?
Tell me honestly, what do you feel?
Shame and embarrassment. Is that part of the cure?
Remind me not to come on this show again.
Oh, you won't have to be reminded, Dr. Ho. We won't be calling.
Okay.
By the way, he's killing me, ladies and gentlemen. That's my point. He's killing me. I'll tell you what. Anything you come up with, you bring it here first.
Okay, I know.
What are you working on right now?
Well, actually, we got a new unit that's coming out in about 2
More
months.
power.
No, it's got enough power, but actually it's going to be called a double massage. You got 2 plug-in with 4 pads because, all the letters that we get, people saying, wow, your machine really works. But I got, stress and pain from head to toe, so I want a machine with more pads. So we got a new machine coming out with 2 plug-ins. So basically, you can massage 2 body parts, or you can share with a partner. We say you can get double the pleasure at half the time.
Nothing like it, huh? Whoa, huh? Oh, yeah, and if you and the wife have a fight that day, it's just dueling Dr. Ho's, huh?
That's right. Who gets the control?
That's right. Whoa. Dueling Dr. Ho's. I like that. I like that. Well, I wish you luck.
Thank you. Thank you.
Can I keep this?
Actually, that one's for you. It's
oh, brand new one,
that's what
right?
we do, eh?
Brand new
when
in the
we get
box.
invited to a show, okay, the hosts always get one, so that we get invited to other shows.
Yeah, that's great. Well, we're going to have you back on, Dr.
Thank you,
Ho, I'll
thank
tell
you.
you. Now, are you working on something outside of this?
Yeah,
huh?
actually, I got a new pillow that we also
Ooh,
developing.
what does the pillow do? Choke people to death?
Yeah, suffocation.
Yeah, all right. Yeah. What is this new
No,
pillow
what we
do?
find is a lot of people with pain, they have trouble sleeping, right?
Yeah.
So we make a really special pillow that conforms to your shape, size, and weight.
Ooh, wonderful.
And you can use a massage pad at the same time, so you can actually get a massage for your neck or shoulder while you're falling asleep. And this device actually got an auto shut-off timer. You can set it for 10 to 20 minutes.
Good
You can
idea,
fall
huh?
asleep with it.
Yeah, good idea. You don't want to fall asleep with 10,000 volts going through you, do you? Huh? Not unless there's some kind of stopgap built in there. Huh? I love it when you smile at me as you play with the button.
Hey, I feel good. I feel good.
Dr. Ho, an evil, evil man, ladies and gentlemen. Yeah. Dr. Ho, big hand for him. We'll have to have you back again. Thank you, Dr. Ho.
Thank you.
Stay tuned for Maya.